Hello, everyone, and welcome to GRUFFtalk, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. I started GRUFFtalk to get the answers we all want to the questions we all have about how to age successfully. If you have questions or thoughts on topics you'd like to see us cover, send an email to grufftalkpodcast@gmail.com. And be sure to subscribe to GRUFFtalk, How to Age Better, wherever you listen to podcasts so you never miss an episode. I am super excited because today we're doing another Menopause Cheat Sheet monthly chat with Dr. Margaret Nachtigall, where we answer your questions about menopause and then talk about some of the top health stories we really think you should know about. Today we're going to focus on belly fat. Yep, abdominal fat, and why it's a challenge for so many women who are going through menopause or after menopause. I'm your host, Barbara Hannah Grufferman. So let me introduce my partner for this episode. Dr. Margaret Nachtigall is a reproductive endocrinologist at NYU Langone Health in New York City and is a leading champion of women's health, especially women in midlife. She's also the medical director of Menopause Cheat Sheet, a newsletter we publish together to help women navigate life before, during, and after menopause. It's free, and you can subscribe by going to www.menopausecheatsheet.com. Hello, Dr. Margaret, and welcome back to GRUFFtalk for our monthly chat about women's health.
Hi, Barbara. Thank you so much for welcoming me so graciously. You know, I always love being here with you, so happy to get started.
Yeah, I mean, we love answering our readers and our listeners' questions, so that's always a lot of fun. And so we're going to kick off the show today by having you answer a question from a listener, and it is about belly fat and why it happens so often to postmenopausal women and what we can do about it. So here is the actual question. It's from Judy M. from Sacramento, California, and Judy asks, I have just gone through menopause, and even though I watch what I eat and exercise regularly, I've gained weight, especially around my belly area. Why is this happening? And what can I do about it? So this actually, Dr. Margaret, right, is one of our most asked questions also at Menopause Cheat Sheet. And it's a real challenge for a lot of women in midlife. So what are your thoughts?
Well, it really is a challenge, and it really is very, very, very common. I see this all the time. Every day, a couple of patients a day are coming in with exactly the same question and exactly the same symptoms. And the truth is that as people go through menopause, what happens is that estrogen levels are decreasing. And also, people are getting older. And with age and lack of estrogen, there is a known increase. There's actually an annual weight gain of 0.5 kilograms, which is a little over a pound a year after menopause. And it's not just an increase in weight, it's actually a decrease in the muscle mass and an increase in the lean body mass, which means that the weight goes up, but the percentage of fat also goes up. And here's what happens is that because in menopause, we know that this is when the ovary is no longer producing estrogen. So estrogen levels are really, really low. But the ovaries do produce a very small amount of testosterone, and testosterone is being secreted by the adrenal glands as well. And so relatively speaking, there's actually a higher amount of testosterone compared with the amount of estrogen as opposed to before menopause. And that change of the ratio combined with this decrease in muscle and increase in body fat leads to a lack of this thing that circulates in the body, which is what binds estrogen, what binds testosterone. It's called sex hormone binding globulin. And when that goes down, we actually get higher insulin levels and we get more what's called insulin resistant. What that means is that we become less sensitive to our own insulin. Insulin, for those of you who know about diabetes, you know that what insulin does is it helps our bodies handle anything that we're eating, any type of sugar, whatever we eat, our pancreas makes insulin, and that insulin helps our body turn whatever we're eating into usable energy. Well, it turns out that as we get less sex hormone binding globulin, as the estrogen goes down, we need more insulin. And different people are more or less sensitive to that change. And so some people, as they go through menopause, are more prone to diabetes. And this is a time where they're going to increase their likelihood of developing diabetes. Other people don't go as extreme to diabetes, but they actually become insulin resistant or less sensitive to their own insulin. And what happens is when that insulin goes up, it actually stores as fat cells in the belly, right in the center. And that center, we call it visceral fat, that increase in the middle, that's actually a less favorable type of fat. That fat is actually less.
As opposed to like fat on your thighs or some other places where women can get that.
Other areas. That actually has been shown to be more dangerous for the heart. And so it really is a kind of fat that not only do we not want because we just don't want to have fat in our middle, but it's also a more dangerous kind of fat. And so this is what's happening. As menopause is going further and we're getting less estrogen, we're getting an increased propensity to develop this middle fat or abdominal fat.
I want to go back to something you said too during your explanation of all this, and that was about the muscle loss. This does happen to people as we get older, as we know, unless we do something about it. Now, a few weeks ago, I had as guests an episode of GRUFFtalk, the writers, the co-authors of The Whole Body Mindset. And it's an actual plan. It's an exercise plan as well as an eating plan. And really, in a nutshell, they talk about this, about muscle loss among midlife people, men and women, and that how timing your protein, not necessarily adding more protein because apparently Americans get a lot of protein already in our diets, but timing it better, smarter. So eating your protein earlier in the day and really your main meals earlier in the day. You know, that old adage about eat like a breakfast like a king, right? And you end up like a pauper for dinner. And that actually, do you believe that can help? Or is this a protein thing? Is it also a strength training thing to help with muscles?
That you said was so critical, which is exercise. I think that activity and exercise, this is essential because actually exercise itself can help sensitize the body to insulin. So that's going to be helpful right then and there. So the more exercise we're doing, sometimes we have to just increase what we're doing as menopause continues, but the exercise is really helpful. I do think that the protein is also helpful because when you're eating protein, you need less insulin and you're going to have lasting energy longer than if you're eating simple sugars or carbohydrates. So this is a time when you're entering into menopause and beyond where changing your eating can be really helpful. Having a diet that's more rich in protein and lower in carbohydrates with an increase in exercise is very helpful to being able to fight off that middle fat. And it is a change, just like our listener asked us in the question is what can you do? What you can do is to change your diet, because if you keep the same diet that you had before,
right, which may have been working for you for many years,
all of a sudden with this lack of estrogen, this is what comes in. And it's really interesting because we don't really know what causes that initial increase in weight in menopause or in aging, because it does happen in both men and women, as you said. I mean, age itself is probably a factor. There's a controversy really on why age at all should increase weight. And the impact on menopause, not only does it have to do with a change in insulin, but there are other hormones in the intestines that are changed with this lack of estrogen. So that can also play a role. In other words, what we're eating, for some reason, there's more hunger after menopause, which is really interesting. And also,
I can attest to that.
Right? and also, sleep is a huge factor. People that are not making estrogen are often having difficulty sleeping. And when you're not sleeping as much and you're tired, sometimes that makes you exercise less. It also has been linked to greater weight gain. with disrupted sleep patterns. People that are sleeping more regularly are not gaining as much weight. So it's this increase in desire to eat and eating irregularly, less activity, that all are contributing to this increase in weight. I think it's all really, really interesting that this occurs. And if we think about it and know about it, because now we do, we can act on it. And the exercise, even the exercise alone, even without changing a diet, is going to be very, very helpful.
What's so interesting to me is that there really is so much information now. And you're a source of some great information for all of us about this. But it just seems to me that almost like the decade between 55 and 65 or 50 and 65, kind of that time post-menopause and before you're really kind of getting in that older category is so critical. Like if you do all of these things that are really good for you during that window, and it's a pretty big window, during that window, you'll be setting yourself up so much better for when you get older, truly older.
Yes, absolutely.
Right? Across the board.
I see that all the
with
time.
all of these issues.
Absolutely. I feel like this is really a great time of life to really take stock of what you can do from a health perspective, because things are changing. People are not getting periods. So that is a sign, okay, my ovaries are not working. And whether or not there are symptoms such as hot flushes or mood changes or trouble sleeping, whether or not those exist, this is still a great time to think about what's most healthy for me. What can I do to make myself my most healthy self? Obviously, stop smoking. If you were smoking, don't start smoking. Don't smoke at all. Limit alcohol. Exercise, eat well, lots of protein, decreased in carbohydrates. And really, this is a great time to start. Go see your doctor. Do what you can do to be healthy.
One thing, too, I wanted to talk about, you mentioned all of these really important lifestyle choices, which I talk about a lot and we cover all the time in Menopause Cheat Sheet. But what about stress? What's the relationship that stress has to all of this?
You know what? Thank you so much for bringing that up. I didn't even mention it. Stress is so important. First of all, this is a time when stress increases because things are happening in the family very often. And the higher the stress, the higher the cortisol level. The higher the cortisol level, the higher the glucose level. The higher the glucose level, the more insulin we need. And then the same thing happens. That means that there can be, if there's insulin resistance and more insulin, that gets stored right in the belly as fat. And fat itself has been known to, it makes hormones. So that can just compound the problem. So I'm really glad that you mentioned the stress as a factor, because I think that is so critical.
So really, just to distill what everyone really needs to do, it's so simple when you think about it, when you bring it down to the essentials of what people need to do to keep belly fat away or to get rid of it if it's been starting. And that's, as you said, to exercise. And I think strength training specifically is really important because of the loss of muscle mass, as you mentioned. Changing how you eat, protein earlier, if we want to kind of follow that whole body reset program. I mean, the science was there, really did make a lot of sense. And, really focus on sleep, which really does not get enough credit and really has such an impact on so many aspects of our health and wellness, and manage stress, however you can do that.
For you. And sometimes that's really hard to do. I will mention one other thing, which is that estrogen actually, I don't want to push it on everybody, and it's not right for everybody, but estrogen can reverse a lot of these factors, and it can help sensitize the body to insulin, and it can reverse this adipose tissue that develops in the belly. And estrogen has been shown to lead to a protective cardiometabolic effect because it is decreasing the fat tissue that is otherwise going to be deposited in the belly. So I would put that in there too.
So when you say estrogen, just wanted to clarify, everyone, Dr. Margaret's referring to systemic hormone therapy, HT, right? Which of course is totally personal, as you always say, and that's a discussion to have with your trusted healthcare provider. if it's right for you.
If it's right for you, and it's not right for everybody, but if it is, that can have some reversing effects, and it can decrease the things that we've already mentioned and the change in the metabolism. There was a really interesting study that was done on 200 women it was just an observational study. It wasn't comparing a treatment of any kind. And what they did is they looked at the incidence of metabolic syndrome. That's where the insulin resistance is so extreme, and there's increase in weight and high blood pressure and other factors. And they saw that the prevalence was 16% in premenopausal women, and in postmenopausal women, it was 42%.
Wow.
So just that change, which is really incredible. And
significant.
And they did some very simple measures just by taking a tape measure and putting it around the waist.
Mm-hmm.
Just by looking at that, 20% of the premenopausal women had abnormal measurements, whereas 60% of the postmenopausal women did. So this was just an observation. There's no question that this is actually happening. And so that the next step is to take these interventions and take this time of your life to be able to become as healthy as possible, and consider all the possibilities from a health perspective that you have for yourself.
And also, you brought up the waist circumference. That is really, really critical, because we are today talking about belly fat. That's right. where where it's being deposited. And right. So everyone, what you could do is, if you don't like weighing yourself, don't, but take out that tape measure. And if I'm recalling correctly, I think the ideal should be like less than half your height is one way of kind of determining what's your ideal measurement for your waist, or maybe no more than 35 inches or something.
And comparing it to your hips is another way to do it. When
that's not
an advantage. But even just looking at change, even if it's not an absolute number, just being able to see how it changes over time and trying to bring it back, I think is
right. And I always like to, bring in the personal in these matters. I mean, I did go through menopause. I did hit 50. And one of the things that was a turning point for me was that I was in fact gaining weight. I was gaining weight in my belly, and I was in shock about the whole thing. And so I did all of these things. I took all of these steps that you described, Dr. Margaret. And we're talking 15 years ago, and I continued to do them, and they continued to work for me.
Honestly, you have been such a good role model and such a good example of someone that really didn't take stock in health and health maintenance before age 50.
No,
and
I
then
didn't.
You realized the importance, you changed your ways, and you made such a huge impact on yourself. And also we're spreading the word for everybody else to be able to do the same. And when I lecture to my medical students and I teach them about metabolic syndrome, and I teach them about aging and what effects that has on metabolism, and I teach them about the importance of not smoking and the importance of diet and exercise and keeping the carbohydrates low and keeping the protein high and exercising and regular activity and sleeping and considering estrogen, I actually show a picture of you crossing the finish line on one of your marathons, because I think you are such a model of being able to do this.
And my gosh. Thank you.
How you incorporate exercise into your daily life. And I think that is.
Thank you for saying that. Thank you.
Really the ideal way to do it. And, it just makes me think back to that question that the person asked, which was, why does this happen? And I mentioned some of the things, but what I didn't mention is that there's some really interesting research right now on why this does happen. Because as I said, we don't know 100% know all of it. We know the things that I described. But really interesting is that in addition to estrogen being super, super low during menopause, FSH, which is made in the pituitary gland, goes up. And there are some really elegant animal studies showing that the elevated FSH may contribute, without the estrogen, just the elevated FSH may contribute to increased adipose tissue in the middle. And there are some trials now. They're only in trials. It's not available for public use yet, but there are trials of agents that are going to lower FSH level without needing estrogen to see if those could reverse these effects.
Wow.
really interesting. And the other really fascinating thing is that in addition to all of these healthy habits that we talked about and all these ways of reducing insulin resistance, there are medications for those individuals where these factors that we talk about aren't enough. There are medications now that can sensitize our bodies to our own insulin and help to reduce this problem. And those have been really beneficial. Just recently, so right now there's some medication that can be taken by mouth. Metformin is one of them, but there's some new agents that actually act to, they're called GLP-1 receptor agonists, which means they act to make pretend that they are changing the receptor. And those agents have been amazing and made great differences. And there was just an article that came out showing that just by reducing them and being on these, that it actually decreased cognitive decline and fewer strokes. And there were real health benefits. So, in addition to the healthy habits, if that doesn't work alone, I think there are medications that people can take.
And the medication you were just referring to, those aren't now available or they're still in trials?
No, those are available, those are out, and those are widely being used.
Oh, so this is something that everyone can discuss with their, if the lifestyle choices are not working.
Is a way to lower FSH levels without taking estrogen, because we know that estrogen can help, but not everyone wants to take estrogen.
Right.
So these are some other agents.
Or can take estrogen,
yes,
even if they want to. Interesting that you brought up metformin. I'm fascinated by metformin, and I know that I really follow a lot of key experts who are in the world of longevity and for men and women. And some of the thought leaders in that universe are really, really, really up on metformin and what it can do. Such a simple drug that's been around for a long time. It's inexpensive to make. It's inexpensive to purchase. And that really does seem to add some time to one's life, along with healthy living, of course.
Along with healthy habits.
Yeah, it's not just, you and I do not believe in popping a pill or a patch or whatever.
No.
The delivery system is to improve your health, we believe, first in making smart choices.
Absolutely. And making those changes and doing those changes as effectively as possible. I absolutely agree. If we can avoid, because anything we take could have side effects or could have more other long-term effects.
Absolutely.
So I didn't mean to say that we should jump on a pill.
Right. No, but always good to know what they are and good to discuss again with your trusted healthcare provider. We have more coming up. We have some new research that's come out that crossed our desks, Dr. Margaret and mine, and that we always want to bring to your attention. So right after this short break, we're going to talk about a few of them. And so stay tuned. Okay, we're back with another episode of Menopause Cheat Sheet Monthly Chat with Dr. Margaret Nachtigall. Now we're going to do a quick overview of some of the health reports that crossed our paths this week, starting with Dr. Margaret, I'm going to, kick it off with this, no pun intended, with this study about, and it's really been everywhere. It's been in the medical journals as well as all the kind of general media. Some people may have already heard about it, but standing on one foot, okay, your ability to stand on one foot, picture that everyone, and how long you can do that for, at least 10 seconds is what they're looking for, can predict mortality. And it's really making the rounds. And people are looking at this and saying, okay, well, what is this? What does it mean? And is this another test for frailty, which is, tied into your mortality risk and how you're going to live your life as you get older? So, Dr. Margaret, tell us a little bit about what you know about this study.
Well, I think it's exactly what you just said, which is, first of all, the study did look at this very simple test, which is, can you stand on one leg where you put the other leg next to it bent for greater than 10 seconds? And to say it, that sounds easy, but actually there's some people that can't. And so the people that can't, that is a frailty index. And that does show that they have less muscle mass to be able to do it. It also highlights people who have inability to balance. And that lack of balance and lack of muscle mass has been tied to people who are probably less healthy. And those less healthy individuals have been shown to be more prone to developing a stroke, cognitive
dementia,
decline, dementia, and will, in their study, died earlier than the group that were able to stand on their foot for greater than 10 seconds. Now, one thing that the study did make sure to say was that they said nothing about causation. They didn't say what caused these factors. All they said was there was an association that people that were unable to do that task had more of those problems. And so I think what we need to think about is, okay, well, let's make sure that people can stand on their leg for more than 10 seconds. So what can we do to increase muscle mass? And it's all the things that we talked about. It's being healthy. It's being able to continue your exercise and build your muscle, and being able to improve your balance and cognitive function. Sleeping probably helps with that too. Not smoking, because people who smoke have an increase in likelihood of developing little blood clots and less thinking. So all of those factors are really contributing. I also think that activity alone is probably enough to be able to maintain that function.
For this particular test, absolutely, no question about it.
One thing that also they showed was that as you got older, there were more and more people that would fit into that category. So in the group that was between 55 and 60, there were many fewer people who couldn't stand. The people between 60 and 65, 65 to 70, etc. That as people aged, more and more people were unable in that age category, were unable to do that task, which makes sense. You would expect that as people got older, it would be more complicated. But for whatever age category we were in, the association still held. And I think that's really interesting.
Very interesting. And again, I'd like to circle back to what we were saying earlier in our conversation, the first part of this show, about how that window of, like menopause through maybe 65, 70, you have that time frame where you can start to do all of these things if you haven't been doing them before. And earlier in life, where you can start to walk more, run, jump, strengthen your legs. Because then when you do get older, when you get into that 70 to 75 or older category, that you are stronger, that you do have some muscle mass to help you stand up on that one leg. I think that's really critical.
And what is really great is it really is never too late to start.
No, never too late.
85-year-olds, 90-year-olds, they can start exercise programs. There are all sorts of different programs that are appropriate to get someone started and get someone moving. That can be really helpful. You start really, really little. Start with a small amount a day. Add 3 minutes a day. Go out for a walk. It doesn't have to be a huge change. It's very small amount.
Small steps, as I like to, so people don't get overwhelmed.
Baby steps, one little thing, and just adding a little bit every day, increasing the length of time that you exercise for. If you did 5 minutes the day before, do 6. Increase the frequency. You used to do 2 days. Now you're doing 3, 4, 5, get up to 6, 7 days. And that's what's incredible is if you didn't do it at 50, do it at 60. If you didn't do it at 60, do it at 80. Whatever time, whenever you're listening, whenever you're ready, this is a good time to start, and start slowly. And of course, it's always good to make sure that you're in good enough health to be able to add that exercise to your protocol.
Right. And the wonderful thing too about building muscle mass is that you can, as you just pointed out, you can rebuild muscle mass, whereas you really can't build too easily. Loss of bone density. And that's a really big difference. As you start to lose bone density, that's very tricky, right?
That's true, but fortunately you can regain some of your bone even when you lose bone. And as we know that as people get older, they do lose bone. And certainly without estrogen, the bone density declines. But there are ways to bring that bone back. There are ways. Exercise helps tremendously. Vitamin D increases bone strength.
We're going to be talking about vitamin D actually in a few minutes.
Right. And so and then of course, again, I hate to bring in the medications, but there are medications that help to build
There
up
are.
many of those. And we'll do another session on
I think on bone health and
bone health.
yeah,
And
because
you
it's
can
such
do
a
because
big
you
issue. It's
can.
such a big issue because
And
if
you
you fall, let's say
like right.
let's say
That's
you're
another
doing that
penalty.
leg test,
Exactly.
you're standing and you fall, you lose your back. That's not a good thing if you have very low bone density.
Yeah, and that was one of the things that was mentioned as one of the reasons why standing on one leg is so important is that if you can't stand on one leg, you're going to be more likely to fall. And fall
Correct.
is a huge risk. Once someone has fallen, that increases a host of complications. I think the study said that there were about 37 million falls. So that's a huge number every
It's
year.
a huge number. It's an
It's a
overwhelming
problem.
number. It's a
Right.
big problem with our health system too. Okay, let's kind of move into another study, but it's very much connected. And this had to do with grip strength. And we've written about this in Menopause Cheat Sheet not that long ago, but a new study has come out, which kind of proves it even more. Your grip strength is connected to your risk for developing dementia as you get older. It's all connected. Your leg strength, how strong your legs are. Can you stand up on one leg for 10 seconds or more?
Right.
How hard can you grip something? What do you say about this?
Just as you said, I think it's another measure that's looking at frailty. And grip strength is something that you can test pretty easily in the office and people can do even at home. And this is something, if the grip strength is not adequate, this is another area where it just says, let's do more endurance, let's do exercise, let's do things. This is a sign, I think, of frailty. And the more frailty there is, then those are in individuals that may be more prone to developing dementia, people that have other coexisting conditions.
Mm-hmm. Would you agree with this? Something I'm just thinking now. When a person in midlife goes for their annual physical, don't you think that there should be some new, very simple tests that are done? For example, having a hand grip thing. I think it's called Diana meter or whatever.
Many
and measuring the waistline, as we were talking before.
So my father, who I believe is one of the absolute best internists in the world. Of course, he's my dad, so I say that, but I really think that he is. And in his office with his patients, he is always on a routine exam, measuring the waist to hip ratio with a tape measure. He has one of those grippers in the office and is measuring that. He will do balance tests. It's part of the routine checkup. So yes, I think it's a great way. And these are some really quick, simple tests.
Inexpensive no for the doctor's office.
No radiation. So it's a very simple test. Thing is, there are other tests as well. And this test is just letting you know that this person may be at risk or may have frailty. It's not telling you why. It's not looking into, is there obesity? Are there cardiology factors that are involved here with the heart? Is there a lung issue? It's not looking into anything causative. It's just identifying an individual that may be at more risk than someone else.
But your father is an amazing man and a wonderful doctor. And, every doctor, internist specifically, should be following his example. Okay, another study. I am a huge believer in the power of vitamin D, the little vitamin that could, I like to call it. We know that in order for the body to properly absorb calcium, you need a good dose of vitamin D. Most people, because they're not really sitting in the sun as much as we used to in days of yore, we're not getting as much vitamin D because that is how you get vitamin D the easiest. And so many, many people are low in vitamin D. I myself take a vitamin D supplement every day. I believe you do too, Dr. Margaret. And but there's a new study out from Australia that shows that being too low in vitamin D levels can increase your risk, again, of dementia. Looks like dementia is kind of a
really
theme, a theme today. So we do know how important it is, but now we know that it's even more important than we realize. What do you say about that?
Well, I agree with you. I think that vitamin D is really, really important. And I think that it is beneficial. Just as you said, if we're avoiding sun, which is reasonable so that we can avoid getting skin cancer, it's really important to be taking some vitamin D, especially after menopause and especially for our bones. And so I really think that vitamin D has been shown to be beneficial for bone. It's important for an immune regulator, so to decrease inflammation. It's also been shown to be helpful for hair and not. So having vitamin D can help prevent hair loss, or another way of saying it is that low vitamin D has been associated with hair loss. Also mood. Low vitamin D has been shown to be a factor in low mood quantity. And so having more vitamin D is certainly a benefit in that way, which is of course really, really helpful. So overall, I feel absolutely vitamin D is helpful. And vitamin D also has been shown to increase balance. So there is also some evidence that vitamin D can be taken safely as long as the levels are below 4,000 international units a day. So it makes sense that many people are going to be vitamin D deficient. And the way that we measure vitamin D in the blood is often not as accurate at what the vitamin D levels are. So I do think it's a good idea to be taking some vitamin D, especially if you are not getting outside a lot. And so it's certainly reasonable to take between 1,000 and 2,000 international units of vitamin D a day, or even many days of the week, or when you remember. I like to leave a big bottle of it out on my counter for anybody in my family to come grab, or anyone that's even visiting to come grab some. Because I do think it's so beneficial for so many reasons. And now, if it looks like it also is helpful for decreasing dementia, then by all means, it makes sense to me to be able to have vitamin D added to our diet.
I couldn't agree more. And I know that there's always research going on about different supplements. But one thing we do know about vitamin D is that it really does work for a lot of things. So that we're going to stick with vitamin D.
The thing is that in the quantities that are reasonable and helpful, it's not harmful. So as long as we're keeping a low dose of replacement, it makes sense, since it's not going to be harmful, that hopefully it is beneficial.
Mm-hmm. Well, we covered so much today, Dr. Margaret. Belly fat and vitamin D and all the really good reasons why we need to stay strong, right? To stand on one leg and
healthy
and have a good grasp, a good grip. Yeah, we've covered a lot. And thank you so much for all of your insights. But before we sign off, do you have a couple of takeaways, your top takeaways from our chat today you want to leave with our listeners?
One takeaway I would say is to use the time of menopause, or use the time of change of life, as a way to really start being as healthy as possible and to be your healthiest self, and to not smoke, not drink a lot, exercise, take vitamin D, as we said, in reasonable quantities, and think what's right for you and seek medical attention. Possibly, maybe you are someone that would be benefited by taking some estrogen. Maybe not, but use this as a great time to be able to move forward as healthily as possible.
Yeah, that's great advice. And I would just say that, make sure that you have all three components of a really powerful exercise program. And one is cardio, running, walking, biking, swimming. And the other is strength training to make sure that you are building up that muscle mass. And then the third is balance. You really want to try to keep that balance so that you don't fall. So try to incorporate all three, and I think you'll be good to go. So, all right, well, we'll meet up again in a month or so. Thank you so much. Talk to you soon.
Good to talk with you.
Thanks for tuning in, everyone. If you enjoyed this episode of GRUFFtalk, please do two things. First, share it with all your friends and family, and subscribe to GRUFFtalk wherever you listen to podcasts, including YouTube, so you never miss a single episode. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon.